Today we will be looking at Surrey IP Pathfinder, and we will be doing a run through pre-go live. Just to overview, we'll be going through a pathway recap, looking at blood pressure in Surrey. We will be looking at GP surgery referrals, so for example, exclusion and inclusion criteria. And we'll be looking at GP clinical supervision, for example, the IP monthly mentorship meetings with their GP clinical supervisor. We'll also be looking at any final actions to be completed before go live. As of now, both IPs have been signed off by the ICB for their site assurance visit and should be ready to go live following completion of any CLIO checklists. So you've seen this before. This is an overview of the pathway from start to finish. The hypertension plus referral will be received from the GP to the pharmacy, and this will be done via Pharm Outcomes via a local services button on EMIS. We'll talk about this in a bit more detail later. The patient's booked into clinic via the pharmacy, and this can be booked in via the usual booking system. Patient attends for their consultation, and we'll look a bit more into what this consultation will look like later. Prescriptions generated via CLIO, and any consultation notes or actions are sent to the GP surgery. Again, this will be via Pharm Outcomes, via a post-event message, and we'll look a bit more at this later. So just to remind ourselves of CLIO, CLIO is a standalone prescribing system, so it doesn't link to any pharmacy or GP systems. IPs will be able to prescribe or cancel any prescriptions that they prescribe. GP Connect Access record will allow IPs to have a read-only live view of the patient's GP records, for example, including blood tests results. And all prescriptions that the IP will be issuing will be acute scripts only. These prescriptions will be visible to the patient on their NHS app. So here is an overview of the clinical pathway diagram for IPs. Everything from when the patient presents to when the blood pressure is taken. And then we can see any recommended actions for if the BP is within range, if the blood pressure is raised, low, or significantly raised, for example, if the patient's symptomatic or significantly low. And we've got recommended actions all the way up to arranging the next follow-up consultation with the patient and safety netting. In terms of inclusion and exclusion criteria, this is who the GP surgery can refer to the pharmacy as part of this IP Pathfinder project. There are 4 types of patients who can be referred via the GP surgery into the pharmacy. The first patient is patients who need initiation of blood pressure medication, so step 1 of NICE guidelines, who have met the threshold for treatment following the usual safety checks, i.e. patients who are not on blood pressure medicines who need starting on a blood pressure medicine. We then have patients who need up-titrating of a previously prescribed antihypertensive, patients who need reducing of their antihypertensive, and patients who need stopping of antihypertensives, for example, in the case of adverse drug reactions. In terms of inclusion and exclusion criteria, the inclusion criteria includes patients who are 18 years or older, who are registered at the participating GP practice, and who have a formal diagnosis of hypertension. In terms of exclusion, patients who are under the care of a specialist for their treatment for hypertension, and patients who have coexisting comorbidities, for example, heart failure, ischemic heart disease, CKD, and diabetes. These patients, the pharmacist should exercise their own professional judgment as to whether their comorbidities may affect the patient's hypertension management and accept referral based on their own judgment. As per what we spoke about previously, exclusion criteria also includes patients who don't have a formal diagnosis of hypertension, who aren't registered at their participating GP practice, and who are under the age of 18 years old. So in terms of GP clinical supervision, this will be monthly meetings with the IP. This can be either a meeting where clinical queries or the patient cohort for the past month can be discussed with the GP supervisor, or any particularly difficult clinical queries the IP has come across in the past month. It can be an opportunity to discuss these here. Alternatively, we've developed two resources which the IP can use with their GP clinical supervisor in these monthly meetings. We have the performance and development plan. The IP can choose as to whether they want to go through this with their pharmacy manager or supervisor, or with their GP clinical mentor. We've also developed a multi-professional prescribing MPP audit tool, and this will allow IPs to record, for example, 10 prescriptions that they have generated in the last month, and they can record the details of these prescriptions on this audit tool. And then once their GP supervisor meeting comes, they can discuss this prescribing with their GP clinical mentor. And things can be looked at here, for example, if IP prescribing matches up with GP local prescribing. This is the Surrey IP Pathfinder full pathway run through. Here we'll be going through what the templates will be looking like for both the GP surgery and the pharmacist for Surrey Hypertension Plus service. First, we're going to be looking at registrations and referral templates. So as discussed previously, IP Pathfinders will be using farm outcomes to record patient consultations. So the enrollment page for IPs will look like this, where IPs confirm their eligibility for independent prescribing here. Now, once, for example, the GP surgery runs a search, sends a message to eligible patients who can be referred into IP Pathfinder, and the patient consents to be referred to the pharmacy for their hypertension management, clinicians will be able to easily refer patients from the GP surgery to their neighbouring IP Pathfinder community sites using the Local Services button on EMIS, which should be visible as shown. This means a quick and easy referral from the GP surgery into IP Pathfinder via EMIS. This referral will then send a notification to the IP Pathfinder community pharmacy for referral into Farm Outcomes. For the IP, this is the registration page for the patient post-referral via the GP surgery that will need to be completed to be able to ensure that the patient's subsequent consultation notes can be matched against the patient's records. We're now going to look at the consultation template that the IP community pharmacist will be using to record their hypertension consultation briefly. Here we've got the start of the template. So for example, enrollment requirements, so the practitioner's name and the consultation date and patient's name. We've then got the service entry and method, for example, if the patient was referred via their GP practice, if it was a subsequent visit, for example, an IP Pathfinder follow-up consultation, or other. We've also got an option to record whether the patient was referred via hypertension case finding service. For example, we've previously sent a document linking hypertension case finding service and hypertension plus service, i.e. this IP Pathfinder hypertension consultation. If you do wish to link the two services, this is an option to indicate that the patient has been linked and referred to IP Pathfinder via the hypertension case finding service. We've then got a text box here which indicates whether the patient was seen face-to-face via telephone or via live video link. We then have a space where you can record whether the patient was accompanied by anyone else and their relationship to the patient, for example, translators, chaperones, or carers. We've got a section for consent, so consent to participate in the Pathfinder program, consent to share information with their GP surgery, and consent for evaluation. This consent for evaluation is for the ICB and NHS England, who will be contacting the patient for evaluation. If the patient consents to this contact for evaluation, there's a space to record their details for contact below. We've then got the patient type. So here it will be patients with hypertension. But below you can specify whether this is a patient with newly diagnosed hypertension needing hypertension medication initiation, or if the patient's already receiving hypertension medication. We then move on to the medical assessment portion of the template. We've divided this into sections. So you've got an assessment of symptoms, medical history, family history, social history, travel history, lifestyle actions taken to date. For example, patient might say they're following the alternate cholesterol lowering plan, previous relevant medication trialed and why it was stopped. For example, patient may have been on amlodipine but found the ankle swelling intolerable, current medications, allergies and sensitivities, and examination notes. We've then got a section for alcohol consumption and smoking status, and a small button below where the IP pharmacist can upload any physical documentation that the patient brings into their consultation. For example, a comprehensive medication list or other relevant documentation that may be relevant to the consultation and the pharmacist wants to record as part of their consultation. There's a space to record whether the patient's pregnant or breastfeeding, and a free text box to include any consultation or clinical notes that don't fit within the above categories. We've then got a section for red flag symptoms should the patient present with any. Moving on to the clinical measurements and tests, we've included a space for the IP pharmacist to record weight, height, BMI, temperature, blood pressure, pulse, breaths per minute, cholesterol, and Q-risk. There's a section next to each measurement, clinical measurement or test, with a drop-down box where the IP will be able to indicate whether they themselves have recorded the measurement at the community pharmacy in that consultation, whether they're referring to a measurement or result that was recorded in the patient's GP records, or whether the patient has brought the result from home. We've then got a section for whether GP records were accessed. So the IP will be able to indicate whether they checked and reviewed GP Connect via Clio for relevant recent blood test results. We've then got a section for goal setting. So this includes goals set for the next follow-up consultation. This may be lifestyle goals. We've then got target clinic blood pressure. So the clinic blood pressure that should be the target for the next follow-up IP Pathfinder consultation. We've then got the consultation outcome, whether advice, medication, signposting, referral, or a combination of the above was given, or whether inclusion criteria wasn't met. We then have a section where if advice was provided, as chosen above, this will appear or disappear as chosen, and the relevant text box can be filled. For example, the specific medication prescribed and quantity and recommended dose. We also have a box where IPs can record script information once they've generated the prescription on Clio. On the prescription generation page on Clio, there's going to be a copy button where the IP can copy script information and paste it here for audit purposes. We then have a section for onward referral. So, for example, if urgent referral is necessary for the patient and who this is to, for example, A&E, GP practice, or out of hours GP, and the time period for referral. Here we have the section where IPs can include any follow-up actions for their GP surgery. For example, any pathology tests, such as the ones that the IPs can choose via the multiple choice section. If the IP wishes to choose another pathology test not listed, there is an other box where they can free text the pathology test they wish to request from the GP surgery. The patient can be given a time frame to arrange the blood test, for example, if the dose of an ACE inhibitor or ARB was changed. The IP pharmacist can tell the patient to have arranged this blood test for within the next 2 weeks. And this can be recorded below. And then we've got a section at the end where a follow-up can be recorded and the appointment date given to the patient. So the GP will be getting the outcome of this pharmacist's blood pressure template via a post-event message. This is an overview of the IP's consultation, indicating whether advice, medication, or signposting was given, or if inclusion criteria hasn't been met. And this is the GP notification. And here we have a section for patient details and medication supplied. Alternatively, if the IP pharmacist has indicated a GP action is needed post-consultation in their template, this will be shown here under the heading Action Required. Again, we have the patient details, the reasons for referral, and actions, for example, pathology tests requested below. Now, in terms of GP actions, there are a few things that may be worth thinking about. For example, the SMS or AccuRx that can be sent to eligible patients to invite them to be referred into the IP Pathfinder program. So, for example, if an AccuRx template is to be created, who is going to be creating this and who is going to be sending this out at the GP surgery? The ICB is procuring a comms leaflet to explain the IP Pathfinder program to patients, which GPs can choose as to whether they want to attach this to the SMS they send patients, inviting them for referral into IP Pathfinder. Examples of the messages that can be sent to patients to invite them into the IP Pathfinder are in the linking hypertension case finding service to IP Pathfinder Hypertension Plus service document that has been sent out previously. However, they're included here below. Looking at the rest of the GP actions, in terms of requesting blood tests, so the IP is to fill out the farm outcomes template, and this will be sent to the GP as a post-event message. It might be worth thinking about whether there's someone at the GP surgery will be in charge of actioning these requests via farm outcomes post-event message. It might also be worth thinking about if there's someone at the GP surgery, for example, a GP pharmacist or pharmacy technician, who the farm outcomes post-event message can be sent to directly, so they can action these directly, and it will reduce the admin time in between. If so, please do let us know who will be best for this specific farm outcomes post-event message to be sent to at the GP surgery. Another means of communication may be needed for the GP to action blood test results. For example, if you require the IP to also add on the blood test requests via your website, for example. The GP surgery is in a good place to now start identifying patient cohorts that they will refer to the IP. So this is worth discussion with the pharmacist, whether you'll start referring all eligible patients to the pharmacist or one type. So for example, Perhaps you'll start off by running a search and seeing how many patients you have that have been diagnosed with hypertension, for example, in the last 3 months, who are yet to start hypertension medication, and then refer these patients onto the IP to start off with, depending on the search result size. It might also be worth thinking about who at the GP practice will be in charge of identifying and referring patients. It might be worth thinking about if this person can set up the initial searches. So once these searches are set up, they can be run. Then subsequently, eligible patients can be sent an SMS or AccuRx inviting them into the IP Pathfinder project. In terms of the GP clinical supervisions, this should be organised and the IP should have been allocated a GP clinical supervisor. And in terms of SOPs, so IPs have been given advice as to generate their own SOPs, both of which have done so. It might be worth thinking about, will these need to be generated in line with your GP surgery's governance requirements for any relevant documentation? And it may also be worth confirming whether the IP has the bypass number to your GP surgery, should they come across any urgent clinical cases in their consultations.